Okay. Okay. Hello, Professor Finley, Jonathan. Thank you very much for joining us for this interview. And I would like if you can please start with describing yourself and your background.
Yes, well, good morning, Boker Tov, to you and everybody else participating in this. I graduated from medical school in England in 1973. That's a very long time ago. And immediately went into pediatrics. Why? Because I found that I love the kids, and I found that the pediatricians at Birmingham Children's Hospital were absolutely the nicest doctors. So I went into pediatrics and did residencies, internships in England. And even before that time, I developed in certain aspects of medicine, particularly the immunology of autoimmune diseases and the immunology of cancer. And a year breaking off from medical school to do a biochemistry degree in that, and spent 4 months at the Karolinska Institute in Stockholm, likewise, gaining that experience, which was very helpful in directing my interests towards cancer and immunology. So in 1976, when I came to the United States, I embarked upon fellowships, first of all, in pediatric immunology, and then pediatric hematology oncology. And then in 1980, so that's 41 years ago, I obtained my first faculty position, which was at Stanford University, Stanford Children's Hospital. And since that time, I've had the honor and the benefit of having worked at several of the leading children's hospitals and cancer centers in North America. Children's Hospital of Philadelphia, Children's Hospital Los Angeles, Nationwide Children's Hospital in Columbus, Ohio, Memorial Sloan Kettering Cancer Center, NYU. And there's tremendous benefit from that because one gets to recognize that there's no one absolutely right way of doing something. That you have to be flexible, you have to recognize that there are many different ways of doing things and doing it right. And one should learn from all of those different ways. So that was a tremendous benefit for me throughout my career in being exposed to different styles and different strategies throughout all the years. When I started at Stanford in 1980, I arrived there thinking that I was going to be doing mainly laboratory research in blood disorders and leukemia. And I was told, well, Finley, you're the junior boy on the block, and we divide all the cancers amongst us, and I'm afraid you're going to get the cancer that nobody else wants. And that's how I got into brain tumors. And I realized back in 1980 that this was an area that was in desperate need for any kind of progress. Only a small percentage of the children were cured, and those that were often left devastated by the radiation therapy and other strategies that were used in those days. So it wasn't difficult to perceive that in a field where there was nobody else involved, I could actually make something for myself and for all these patients. So that's when it started 41 years ago. And basically I've been focusing on the problems of children, adolescents, and young adults with primary brain cancer ever since that time. And although I finished my full-time on-site clinical work at Nationwide Children's Hospital and the Ohio State University in August of last year, I am not retired. I want to stress that very firmly. I'm very much involved in consultation work with Israel and also with organizations in China. But I'm also very much involved in leading a multinational prospective clinical trial for young children with medulloblastoma, which some of you may have heard of, known as the Head Start clinical trials. I continue to be the principal investigator of that. So I hope that summarizes how I got into all of this and how I've come along to where I'm at the moment.
Definitely. So thank you so much for explaining your path. And I do know that you have your, I believe, in treating kids specifically with brain tumors. Can you share it with us?
Yes. first and foremost, there is no such thing as a simple childhood cancer, especially when you're considering brain cancers and soft tissue cancers of children. These are very complex, and I believe that every child, every family merits and deserves right up front consideration of alternative strategies, at least one second opinion, be it from a surgeon or an oncologist. Every child merits the best shot right up front. And as you are well aware, many of our children still relapse. Some of these children, although in diminishing numbers, are still retrievable and curable with care and with good management. And again, I think a child and a family deserve the opinions to know whether their child should be on that path or whether others, leaders and authorities feel that it would not be fair for a child to proceed further. So the bottom line is every child, every family deserves a second opinion, and particularly in this day and age of internet access, there should be absolutely no geographical limitations to preventing these kind of consultations. Does that help?
Yeah, thank you so much. My next question refers to what is your opinion about proactivity of the family in treating the kids that is suffering from cancer? Do you have any specific opinion? Do you think the family should be proactive in their approach or just depend on the doctor that is treating the child?
This is cancer, like any severe illness, be it acute or a chronic illness in a child or an adult, is a family problem, and especially in children. And the family need to be intimately involved in the decision-making as best. Not always can families understand the complexities, but we as physicians, as healthcare providers, must do our absolute utmost to explain the pros and the cons, the risks and the benefits, and present alternatives right from the outset and involve the families in those decisions. Now, there are some variations in philosophy in this regard, for example. So I've always believed that one walks a thin line between being patronizing as a physician, which I absolutely don't want to do, but also saying, okay, this is too complicated, you parents decide. I think both extremes are not good, especially when it comes to parents with children. Some families, as you know, are very smart, very forthright, very determined, and may make decisions which I'm not saying bad or wrong, I'm not going to that extreme, but alternatives from what, let's say, I as a physician or others might recommend. I feel in that situation that whenever I possibly could, I have decided ultimately and tried to support the family in that, because the decision that they bring upon their shoulders, they're going to live with that decision forevermore, whatever happens to their child. And that could be potentially a hell of a guilt trip for a family. But again, the other extreme is equally, if not worse, and that is, oh, I'm the physician, I know what's best for your child, I've been doing this for 20, 30 years, what can you know? This is what we do. That is a wrong approach. I feel that after I've talked with a family, however long it takes, and it's not at one session, it's at several sessions usually, but if I have not done a good job and explained to them and justified to them what I'm recommending, then that's my problem, not the parent's problem, and I have to do better. And maybe in those circumstances, give the family the opportunity, if it's not been raised already, for a second opinion. Sometimes these decisions, especially with childhood brain tumors, are extremely complex, and there is no absolutely right or wrong answer.
Thank you. My last question refers to your work with our organization, My Child's Cancer, or My Child in Hebrew. And we've been communicating for many, many years, a decade, you and I, and you helped dozens of families from Israel along the years. Now we are taking it to the next step of creating the advisory board. So I would appreciate if you can just refer to your work with us and what do you think about our mission.
Well, I'm extremely excited at the transformation that your foundation has undergone in the last year. And indeed, your foundation is a shining example of what I stated earlier, that in this day and age, there should be absolutely no geographical limitations, whether it's within the country or internationally, from access to the best opinions that are available. And I believe that we together have gathered some of the world's authorities in Europe, as well as in North America, in different aspects of childhood brain tumors and other cancers, for people who are leaders in the field and are absolutely willing to provide those kind of consultations. And we've not needed it yet, but if we need more than one, if we need to, because of the controversies that can exist, we'll do that too. Your foundation has gotten off to a magnificent start.
So, Dr. Finley, thank you so much. First of all, for this interview, and second of all, for your amazing help for our organization and for kids all around the world and the kids that come through our organization. It's really unpriced, your help and your dedication. And I hope that you will continue to help in the curing of many more kids. Thank you so much.
Thank you. So do I. Thank you. Keep up the fantastic work. Thank you.
Thank you.